Hello and welcome to UNC Rex Health Talk Live, brought to you by UNC Rex Health or UNC Rex Healthcare. I'm Sharon Delaney and we're coming to you live from UNC Medical Center in Chapel Hill. Tonight our topic is Food Allergies 101. So start sending your questions in right now. Whatever your food allergy question might be, we have an expert here to answer your questions. Joining me is Dr. Edwin Kim, and I'm going to have to pick up my paper because all your things, your introductions are very long. Now, I don't want to make you feel uncomfortable, but check this out. Director of UNC Food Allergy Initiative, Director of the UNC Allergy and Immunology Fellowship Training Program, as well as Assistant Professor at UNC Division of Rheumatology, Allergy and Immunology, and faculty at the UNC Thurston Arthritis Research Center. Do you ever sleep?
I try.
That's a lot going on. But really, one of your specialties, Dr. Kim, is food allergies.
That's right.
And not only as a professional, but as a father, too. Tell me about your child.
Yeah, so actually I've got 3 kids, and so my middle son, Elliot, who's now about 4 and a half, he actually has peanut allergy as well. And interestingly, he developed his allergy while I was in the middle of doing all the research that I do now. And so it was a real big game changer for me, because I had always sort of seen it from the physician, the clinician, researcher point of view, and suddenly this became real for me. So all of a sudden, he was about 9 months old, and we had introduced him to peanut, just like is being advised these days early on. But sure enough, shortly after eating the peanut, he started developing redness all around his mouth. So similar to stories other people have told me, started scratching everywhere. And me being an allergist, of course, I knew what we were dealing with. I actually, as it turned out, had Benadryl sitting right there on the counter in case. And so we treated him, but over the next hour, really, he started developing all the symptoms that we worry about. So
bad ones, like
wow. And so he shortly afterwards started having vomiting. He developed a rash that eventually became head-to-toe rash, and even had coughing, which is a sign of potentially having trouble breathing.
Oh goodness!
Yeah, and so
at 9 months of age, he couldn't tell you.
He couldn't, and so it was frightening. And so, eventually we got him to medical center, and he got his epinephrine, just like a lot of other kids have had to do with their reactions. And he got better, and sure enough, we had testing shortly afterwards that confirmed what we knew, was that he was allergic to peanut. And so from that day on, again, the research, I've continued to do the research, but I've definitely seen it in a very different light, because a lot of, again, the things that these families have been going through, we're sort of living it at the exact same time.
You really probably have a lot of empathy for your patients, because you can't say, well, let me try to understand. You really do understand what they are going through.
Exactly, yeah.
I'm sure they love that they have a sympathetic partner in treating their kids.
Yeah, I mean, I wish there was an easier way to kind of get there.
Yeah, sorry that is the case.
Yeah, it really is the case. And even the simplest things of how do you deal with situations like going to school or going to restaurants. I mean, these things that families with food allergy have to deal with every single day. I tried my best before Elliot to sort of get on the same level with them, but it's not until you live it that you really understand
that you know it. Now, you are leading some research that is being done right here at UNC, and you're doing a 3-year study. We featured a sweet little family in getting ready for this show. We got to meet this nice family with little Jane, who's 4, getting ready to start school next year, and her parents are understandably quite nervous about letting their little one go off, and they can't watch every morsel going into her mouth. Tell us about this research and the trial that she's in.
Sure, and so the overall concept of all of these trials is something we call immunotherapy. And immunotherapy, what that is essentially giving small amounts of what a person might be allergic to, with the idea of building it up and essentially retraining the immune system, trying to make it, again, be able to tolerate the food or foods that they may be allergic to. We're trying to do this in a bunch of different ways. So the way that we initially had tried to do this was actually in injections and shots. And this is many years ago, probably 20, 30 years ago. And unfortunately we saw a lot of side effects, we as researchers. And so that one sort of got put on hold. But since then, we've started to look at trying to do it in a form that's eaten, so flour forms, and in her case, actually trying to do them in liquid drops that they hold under the tongue. That's right.
And she's a great little patient, and she's following the instructions. And after the end of the 3 years, you're hoping you can do it like a challenge test to see how much she could tolerate.
That's right. And so on the first day of this study, what happened was we did her challenge as well, which is a very frightening day because she hadn't been treated yet. But what we try to do is establish, confirm that they are allergic, and then establish what that baseline is. How much does it actually take to get sick, to have a reaction? And then we do our treatment and then do it again to try to show that, yes, we have provided a level of protection that the children have, and to give those families some level of confidence when they actually go out there into schools, into restaurants, or wherever it may be, that there is a level of protection.
Sure. Okay. If you're just joining us on Facebook Live, we are coming to you from UNC Medical Center here in Chapel Hill, and our topic tonight on UNC Rex Health Talk is Food Allergies 101. We want you to send us your comments and questions now. We already have a couple of people who sent in some questions ahead of time. Let's see. We want to say hello to Alana and Katie, and Alana is asking, we just found out my son has a peanut and an egg allergy. I'm also afraid to try tree nuts. How likely is it that he would have an allergy to those as well?
Yeah, and so that's a really, really good question. And so what we do know is kids who have peanut allergy and even egg allergy, but especially peanut allergy, seem to be at higher risk of allergies to tree nuts. So in this situation, it definitely would make sense to go to an allergist and be evaluated to confirm this, whether or not they actually have the allergy. And that may mean skin testing or blood testing, but unfortunately there's up to a 30% chance that there could be an overlap where someone with peanut allergy has a tree nut allergy as well.
Okay. All right. Also, Beth would like to know, she wants to know about some insights into new research regarding tree nut immunology or therapy. Like you were discussing with peanuts, do you have a similar sort of clinical trial going for tree nuts?
Right, and so at this point, those are in development. So for the last bunch of years, we've really focused on peanut to try to optimize what we're doing, and we have seen a lot of good preliminary data. And now I think we're starting to take those same ideas and shift it over to tree nuts. So I wouldn't be surprised in the next couple of years to start to see more of these studies start to come out. And one interesting thing with tree nuts is there is a hope that there is an overlap between the different tree nuts. And for example, I mean, if you're allergic to walnut, perhaps if we can treat the walnut, maybe the cashew allergy would get better, or the pistachio or something else like that. And so that would be a really nice thing that we could discover in this as well for tree nuts.
Okay. We had a question come in from Jessica. Why does it seem that there are so many more people with food allergies than before? I know when I was growing up, I don't think I knew a single person who had a food allergy, and now it seems to be quite common. Is that just perception?
Oh no, so that's the thing. So I mean, every family, parent, or anyone else that I meet, they all have that same question. And all of us say the same thing. We knew nobody, or maybe we knew one person. So clearly there's a tremendous increase. A couple things we know of. So one piece is we know there is a genetic component. So there is some family history that probably sets people up for it, but not everybody has that family history. And so what we also know is there's got to be an environmental component to it. And that's where we get stumped is, you know, a lot of folks are worried about, is it the way that our food is being produced or processed? Is it other exposures that are out there as far as antibiotics, or is it exposure to the sun? Is it, you know, other things that could be happening, to infections or otherwise? And to be honest, at this point, we just don't know. And a lot of the research that we're doing in the background is trying to understand why people are becoming allergic. So what is changing in the immune system? And not only trying to get those patients better, the ones that we're studying, but also through them learn more about this. Yeah.
Okay. All right, this is a really interesting one, and we brought a plate of meat to illustrate it. It's not a laughing matter, actually, but Michelle is asking, I've been diagnosed with alpha-gal. I'm allergic to beef, pork, and lamb. What are researchers doing to potentially either get rid of this or treat it? And that's a really odd one. Tell people what alpha-gal is, because a lot of people haven't even heard of it.
Yeah, and so alpha-gal is sort of a nickname for a new allergy that's really started to become a problem. We've started to notice more in the last probably 5 to 10 years.
And specifically here in North Carolina and in the Southeast, right?
That's right, yeah. So Virginia and North Carolina are major hotbeds for this. And one of the reasons is different than most other food allergies you'd think of. It seems to be actually related to being bit by a tick. And this tick happens to live in the southern states, including Virginia and North Carolina. And it seems that the tick somehow, again, we don't understand how, is setting people up to develop this allergy. Once they have it, it's not an allergy to one food like maybe in the case of peanut, but it's an allergy to all these different meats. So basically all meats that come from mammals such as beef and pork and lamb. You can stretch it out to deer and bison and whatever other kinds of meat. Really the way I try to describe it to patients is that really the safe meats are more poultry and fish, but everything else sort of beware.
My goodness, and how do... we spend time outdoors. You hear about ticks all the time in the summer. I mean, does it take a while to realize what's going on? Do you have the allergic reaction right away after getting bitten by the tick, or does it take some time?
Right, and so even there, we're trying to understand that, because some tick bites we're well aware that we got, and many of them we don't, and it could have been that it happened years before or whatever else. Some studies have shown, again, immediately after tick bites, that there are changes in your immune system, so it very well could be sort of a next day type of situation that's going on. But another piece that's really interesting with this meat allergy that shows that it's potentially a different type of allergy is that most food allergies, when we're thinking about, say, milk or egg or peanuts, those usually happen within minutes of eating the food. And in the case of these meats, for whatever reason, it takes an extended period of time. So it may be 4, 5, 6 hours after the first person eats the food that they actually have these symptoms. And that could be difficult in that there might be the scenario where you go out and have a wonderful anniversary dinner. You have a nice steak dinner. You go home and you think everything's fine, you go to bed, and then the next thing you know, you wake up at 2 in the morning covered in rash, or maybe even feeling like you need to vomit or something like that. And so there are definitely aspects of this allergy that are very different, and that we're trying as best as we can to learn more about how all allergy works through this strange different allergy.
And what's interesting to note too is UNC is one of the leading institutions in this research.
That's right.
And partly because of our proximity to it, I suppose.
Right. So, again, we have many patients in the region that have had this, and we've also recruited experts from the Virginia area that also have brought a lot of patients as well. And so it's just been a great place to be to try to learn this. And we have patients that are basically, banging down our doors to try to come in and volunteer to help us learn more about this.
My goodness, Michelle, I hope that helps to answer your question. At this point, it's just in the research phase. There's no real treatment except avoid all those meats.
Unfortunately, at this point, yeah. It is really about understanding, again, why this is happening, how is this different from the other allergies we know about, and hopefully really quickly after that we can turn it into what can we do to treat this.
Okay, all right. Grace wants to know, why are so many people unwilling to take food allergies seriously, and what can be done to better educate the general public about this?
Sure, and I think there's a couple things going on there. One of them is exactly that idea we talked about before, that many of us growing up never saw anyone with allergies. And so all of a sudden, why is there so much more? And so I think there's, first of all, that perception that, again, is this something made up? Also, there is, again, until you've actually seen someone with an anaphylactic reaction, it's not real. And so I think there's a couple of those different things that sort of make it difficult. Another piece to it, and again, I'm sorry that it's multi-pronged, but it really is that the testing that we have available is also imperfect. So unfortunately, there probably are some folks out there that are worried that they're allergic that maybe is not. So there might be a small level of overdiagnosis, but I think a lot of it really has to do more with just this is not something that we used to deal with. And all of a sudden in the last 10, 20 years, there's so much more out there, and we can't tell anyone why at this point.
I'm sure there's a lot of theories.
Oh, yeah.
that could be a whole other show.
Sure.
So let's talk about some of the more common allergies, which I would imagine are the dairy ones.
That's right.
So milk, eggs.
Yep. And so when we think of sort of your classic kind of anaphylaxis, potentially life-threatening allergies, really there are 8 sets of foods that are going to be most common. And that's going to be milk, egg, and peanuts, of course, but then also your tree nuts. And then you have your shellfish and your fish, and wheat and soy fall into that category too. And we think of those 8 groups of foods as basically accounting for 85, almost 90% of all food allergy that's out there. And again, clarifying that this is sort of the anaphylactic life-threatening allergy that we're talking about.
Okay. All right. If you're just joining us, this is UNC Rex Health Talk. We're live from UNC Medical Center in Chapel Hill. We're taking your questions tonight about anything to do with food allergies. Dr. Edwin Kim is a researcher and professor here at the Food Allergy Center, and he has a son who also has a food allergy, so he's the expert on all things right now.
Right.
We're taking your questions. We'd like to say hello to Ashley and Lindsay. Misty would like to know, where can we do oral immunotherapy?
Right, and so again, that idea of immunotherapy being small, increasing amounts of what you're allergic to. So oral typically is going to be taking flour forms of the food you might be allergic to. So in the case, peanut flour, milk flour, egg flour, something else like that. At this point, it really is something that's still in research. It is something that we've seen a lot of good preliminary data, and we are very hopeful in the next couple of years that this will be available to the public, approved through the FDA. There are some practices that are trying to they're trying to provide this as a service at this stage, but we are somewhat hesitant on that because we do feel like there are still some major safety and efficacy questions that are out there at this point. So we do think of this as purely a research.
So it's still
type
in
of
research.
thing. That's right.
But if you are local, could they apply to be in one of your trials?
That's right. And so we're constantly involved in different trials, again, trying to understand the different aspects of the allergy and the treatment. And so on our website, we actually have a place where folks can actually sign in and really tell us a little bit about the allergy they're dealing with so that we can quickly be able to respond to them when the appropriate trials come up.
Okay. Dallas asks, I hear a lot of discrepancy about the best age to test infants and children for allergies. What is your recommendation?
Yeah, and so again, we kind of joke with our trainees that for the skin testing that we do, as long as they have skin, we can kind of test them. But in all seriousness, really it comes down to when the right time is really when that family is going to do something different about it. So testing someone who's never going to eat that food for the next 3 or 4 or 5 years probably doesn't make sense. But if they're at a stage where, for example, they're about to go to school and they want to know, is my child allergic to peanut and they're going to be exposed to school, for that family, that would be the right time. Or for perhaps the kid who's been having formula and about to switch over to some sort of soy or milk or something else. And so really that would be probably the right time. And so that's usually going to be a discussion within the family, potentially the family with the pediatrician, and then ultimately with the allergist as well.
Okay. Amy would like to know, she'd like to get both of her children tested for food allergies, adding that she wants a large panel done, but apparently her pediatrician's office doesn't offer a large panel. So what would be a resource for her?
Yeah, and so that I'm glad that that question got brought up, because I think that is a place where a lot of education could be helpful. Is unfortunately the testing that we have available, so our blood and our skin testing, although it's good, it's far from being perfect. And there is sort of there's a higher than we would like chance that people could have a false positive reaction, meaning the test says that you're allergic, but you actually are not. And when you do broad panels of food, meaning many 50, 60, 100 foods, you run that risk gets higher and higher and higher. And for any family that's actually actively trying to avoid foods, they could easily tell you how difficult it is to avoid one food and potentially to avoid many foods, and theoretically for when they're not even allergic, could just be terrible. And so we really do discourage sort of doing many foods, and really try to focus in on what are the foods that child is eating at the moment, what are the foods that are causing the problems, and try to hone in on those as best as possible.
Instead of just doing everything.
That's right.
Okay. All right. Aaron, hello to you, and hello to Ashley. And Shelley would like to know, she's a dietitian. Her clients often ask her the difference between blood tests and skin tests for food allergies. What is the difference, and is there an accuracy difference as well with these tests, blood versus skin?
Yeah, so that's a really good question as well. So both tests, the skin and the blood, try to tell us the same thing. They're really trying to show us, is there that part of your immune system that can cause allergic reactions? So when you talk strict numbers, they're pretty much equivalent. Skin tests, the slight added benefit there is it actually shows you not only do you have that component of your immune system, but it actually causes a reaction, a little itchy bump that's on your skin. And so it gives us a slight increased confidence in there. But in reality, both tests should be near equivalent.
Okay.
Now, I will add in there that for a lot of patients who are allergic, checking the antibody level, checking this immune level is a way that we can track whether they're trying to outgrow it. And a blood test seems to be a slightly easier way, I think, to actually track trends. And so the way I usually approach it is very often when I'm first trying to diagnose someone, I'll lean towards the skin test, but then over time as I'm tracking it, I may do a blood test. But each practitioner might be slightly different in that.
Now, I discovered something recently, and when I first met you, I told you about it. I'm not even going to touch it.
Don't go there.
Because I have mango mouth.
Right.
Right?
Mm-hmm.
Sounds crazy. My lips blow up
right.
when I eat mango if I get the skin of the mango too close to my mouth. Right. What is that?
Yeah, and so it's just a fascinating part, and a lot of folks who study plants probably could tell us this, but I discovered this as well in my own training, is that as it turns out in mango, in the peel, there is the same oil that's contained in poison ivy and poison oak. And so but again, just by touching it, you can get that same kind of rash, and I'm sure you could tell me all about it, that crazy itching sensation that you probably had from it.
Well, here's the crazy thing is I said this at work the other day, like, why were you rolling around in poison ivy? That sounds insane. I was camping
right.
and was in the poison ivy, didn't realize it until someone said, you're inside the poison ivy. I am not allergic to poison ivy.
Yeah.
But yet that makes make me go la la.
Right. Well, so that, you know, well, we're going to probably have to figure that out for you then. Yeah, the typical scenario I would think of would be related to that, but it's possible that there's a whole nother scenario that's going on for you. And I'm guessing that that's what you're going to ask me with these other fruits. Yeah.
Well, that's the thing too. I thought that was very interesting that certain people also have, and what are we calling it? An oral.
That's right.
Oral allergy syndrome. Is that to certain kinds of fruits? And what is that?
Yeah, and so, you know, we're actually outdoors in the exact time of year that's perfect for that. And so oral allergy syndrome is something where, and actually I suffer from it as well. So looking at those fruits makes me itchy already.
Oh gosh.
But as it turns out,
now.
folks who have allergies to pollen, they have this part of their immune system that is specifically looking for that pollen to cause allergic symptoms. And what we've discovered is that there are proteins that are in these different fruit that are here, so the pear and the peach and the plum, that look very, very similar to your immune system to that same pollen, so it can overlap and cause a tremendous amount of itching in the mouth, in the tongue, even in the back of the throat. And a lot of the patients who come and see me who have this symptom, they worry, oh, there must be something, a pesticide or something that's going on with these fruit. But as it turns out, there's a lot more of that protein in the skin. And so for a lot of patients, peeling that off will somehow make it better for them. But especially during that season, so in my case, during the spring season when that part of my immune system is really fired up, that same allergy to those fruits is unbearable. So
wow.
I'm going to avoid those.
Okay, so it makes you all itchy and it's just very uncomfortable. Okay. Let's see. Kim asks, I've had an onset of tree allergies as an adult. Is it likely this will fade or go away?
Yeah, and so tree nut, kind of like peanut, unfortunately is an allergy where most people do not outgrow it. We estimate maybe 20% of people outgrow both of these allergies, peanuts and tree nuts. But even there, most of the people who are going to do it, they do it as a child. And so most adults who have those allergies, unfortunately the bad news is they'll probably hang on to it.
Okay. Similar question, Linda is asking, I became allergic to shrimp at age 32. I'm now 59. What are the chances that she may have outgrown this? And how would she find out without eating and swelling? Yeah,
and so unfortunately there's bad news here too.
Oh.
So for shellfish and fish, we think of it very similar to peanuts and tree nuts. So we think it's very likely, especially as a grown adult, that this will probably stay with her for most of her life.
There's not a way to reverse that sort of thing?
Not at this point. Again, we are slowly starting to think about the same treatments that we're thinking about for milk and egg. Can we transition those over into seafood? Because it does affect a tremendous amount of adults that are out there. We're just not there yet. But unfortunately, other than trying to eat it and seeing what happens, really it comes down to those same types of tests, the skin test and the blood test, to try to help predict whether that person has outgrown it or not.
Okay. Hi, Christian. Hi, Marie. Thanks for joining us on UNC Rex Health Talk. Angela asks, my son is highly allergic to fish, including salmon, tuna, and cod. We carry an EpiPen for it. And can he possibly eat scallops and mussels? And is there a safe way to find out?
Yeah, and so there, I think there's a couple things that we'll talk about there. So one of them is we do think your immune system is very specific to the particular food that you're allergic to. So those antibodies that are allergic to salmon should not be reacting to mussel. So it's possible that that person is allergic to mussel. But again, it wouldn't be sort of those same antibodies.
Okay.
But I think another piece that's important to think about, though, is not only sort of what's going on in your immune system, but what's actually going on at the fish counter or at the restaurant. And so unfortunately, if you think about most restaurants, they're not separating out mussels and salmon and tuna.
They might all be prepared on the same counter.
The same counter, the same fridge, the same knife, whatever it may be. So even in cases where patients may not be allergic to all the different seafood, there's always going to be that chance of cross-contamination. So for many families or many patients, the safest way to go is to try to avoid them.
Or if you're really wanting to try do it at home where you control the environment that you're preparing and cooking it. Okay. Let's see. Shelley asks, my son is tree and peanut allergic. How does a doctor determine if a child's numbers qualify for oral immunotherapy?
Sure. So again, what they're talking about there is going to be how much of that allergic antibody do you have in your system. So whether the blood test is a big number or the skin test is really, really large. And at this point, really, we've taken all comers for our studies. We've taken people with numbers that are in single digits and then even ones that are sort of higher than the machine can even detect. And we've seen benefits really for everybody. There is sort of a hint with some of our research that the lower you start, the better. But again, we've taken all comers and we've seen benefit at all levels. So I think that's one of those where it really is going to be important to go to the allergist and have that discussion and see if it's appropriate for other reasons. But I don't know that that blood test itself would be a reason not to.
Okay. Walisha says, my son outgrew tree nuts at age 12. He still has dairy and peanut allergy, so she hasn't given any tree nuts, just in case. He's now 15. I feel like I shouldn't let him try tree nuts unless he outgrows the peanuts as well. Now, what you said before, there's a crossover, right?
Right. So there, I'm going to qualify that a little bit in that one good thing that's come with the increase in food allergies, there seems to be a lot more sort of just a general awareness of it. And one of the things that's come with that is labeling of foods is better than it was. And so in the world of peanuts and tree nuts, I feel like there is better labeling to the point where you might be able to discriminate that more. And so we do have more patients out there now who have peanut allergy that do feel safe and confident eating tree nuts, again, reading off of labels as well. Again, not really the case for fish and shellfish at this point because it's not typically packaged. But for peanuts and tree nuts, it is something that may be more realistic than it was, say, 10 years ago.
Okay. Walisha has a follow-up question. She's heard that coconut is separate from tree nut allergy. Is a coconut a nut?
Exactly. So that's
the question. I never even thought about that.
We think of it as a fruit and not a nut. It has the word nut in it, and so it's gotten really confusing. But there have been a lot of small studies that try to prove the fact that it doesn't overlap. And so that I would think of that as a totally separate type of thing. And unless that person's really eaten coconut and had a problem, it would be fine.
Are there people who are allergic to coconut?
There are. Unfortunately, there are. But it's usually not going to be something that's overlapping at all with the other tree nuts.
Okay. Linda asks, or Lisa rather, she had a reaction to oysters at 19 and has not eaten any seafood since. She's now 59. Do you think she could try to eat shrimp?
Yeah, so I think, again, this is something that if it's important to her to have shrimp, then it's absolutely worthwhile to go to that allergist and get that testing done.
Just to be safe.
Yeah, and for two levels. One of them is that it's a different food. We're talking about shrimp versus oyster. And also with that amount of time, although not a lot of people outgrow it, some do. And so it would be helpful to find that answer out.
I wanted to go back and ask about the alpha-gal. Because you were describing how it's different than sort of the peanut and some of these other ones where there's almost an immediate reaction, but it could be hours after you've eaten this nice steak dinner that you're all of a sudden getting up at the middle of the night very ill. Do people think that that's actually food poisoning? Like they may go to their doctor thinking they've gotten food poisoning or something like that?
That's exactly right. And it's hard to tell the difference because food poisoning can, of course, cause throwing up, horrible stomach ache as well. And so usually one of the first things folks will do is if they've gone to dinner with other folks, who else got it? Because anyone else who's had the same dish you would suspect should have that problem as well. Or at the restaurant, maybe restaurants may not be willing to share that information, but someone else may have ordered that same dish. And if other people at the restaurant have that problem, that could be one way to answer it as well. But unfortunately, a lot of times, especially with the alpha-gal, what you find out happening is people are going to have multiple reactions.
And then they start figuring out something's not right.
Then they put two and two together. And
I actually have a friend who I believe she is an environmental scientist is her career. And during her thesis, she spent a lot of time in wetlands. And she got bitten by the tick. And it took 6 months to figure out that she had alpha-gal. It was like the craziest thing. She was sick and then well because she never put two and two together, that it was always after she ate some kind of red meat that then the sickness began. So it actually took a good 6 months to figure it out, which is probably not that long in the alpha-gal world.
Yeah, that story is very, very, very common. And again, because with the other foods, you eat it, you get sick within a few minutes, you can make that connection directly. But when it comes to sort of the timing, and then even with the alpha-gal, again, we don't understand why, but there are situations where people can eat small amounts and be okay with it. So it doesn't necessarily happen every single time you eat it. And that makes it even more confusing as far as trying to figure this stuff out.
Okay. Kristen asks, my son has an egg and peanut allergy. He also has reflux, which used to be severe before we determined his allergies. Are they related?
Right, so a couple things could be going on here. One of them is there is a whole other disease that looks very much like reflux that's called this big word Eosinophilic Esophagitis, but it's basically an allergy in the feeding tube, I know. We call it EOE, which is a lot easier.
Say it again.
So it's Eosinophilic Esophagitis, but EOE is definitely good enough.
Wow, we'll stick with EOE.
We'll definitely stick with that. And so with EOE, very much what the symptoms can look like on the outside is trouble swallowing food, maybe regurgitation, maybe even straight up vomiting. And so for some folks, that's what's happening. Those foods are triggering this other kind of allergy as well. In other cases, it could just be that they do have bad reflux, and again, for whatever reason, these trigger foods is making that go on. But for someone where there is sort of a direct connection that they see with this food, it may be worthwhile to, again, start that conversation with their doctor or their allergist.
Okay. Another viewer wants to know, can you get mango mouth with fresh pineapple? Well, it would be pineapple mouth, right?
Right. And so, I mean, that would be sort of a nice segue into, there are some folks where different types of citrus can cause what sounds like what you described with mango mouth. And there, again, likely what's going on is they're having more of a reaction to the acid, the citric acid. And so it could be that not only pineapple, but other citrus fruits could do that, or it could be very specific to pineapple as well. But it probably is very similar to what you described, and maybe not necessarily related to poison ivy oil or anything else like that.
Okay. Elaine asks, my son is severely allergic to wheat. We discovered his allergy when he started eating solid food as a baby. The doctor predicted he'd outgrow it by age 5. He's 13 and still cannot eat anything with wheat. Are there any food desensitization studies going on here at UNC for wheat allergies? Yeah,
so unfortunately at this point we're not involved in any particular studies focused on wheat. Okay. There are definitely other major food centers out there that are doing it, and the number of folks out there with wheat allergy continues to grow every day. And so I think again, as we are learning more about peanut allergy, I think that attention is, in a good way, spreading out to other foods. And so wouldn't be surprised if we start studying wheat in a very near future, especially again, considering other places are doing it at this point.
In your field, Dr. Kim, are there researchers who are trying to find the source of why there is this uptick in allergy?
Yeah, and so I think one of the ways that we're really hoping to do this is to try to do essentially sort of what we call birth cohorts or even registries. The idea of finding folks before they're even allergic and then track them over time and see when do they become allergic, and then try to work backwards and see if were there any differences in their exposures. Was it where they grew up? Was it what they drank as a formula? Was it whatever else it might be? But as a way of trying to answer that question, because right now sort of working backwards with someone who's already allergic is helping us only to a limited amount. But I think really finding folks before they're allergic and then tracking them through becoming allergic is going to be probably the way we find this answer.
Yeah, and that's really many decades of study involved with that.
Unfortunately, many decades and lots of people.
Lots of people. Okay, well, questions are still coming in, but it's going to be time for us to wrap it up. But we will answer your questions. Just keep them coming. Put them in the comments section. And the nice folks here at UNC and UNC Rex Healthcare will answer those for you. Dr. Kim, thank you so much.
Yeah, thank you.
I wish you the best of luck with your son.
Great, thank you.
And with the rest of your clinical trial work that you're doing here at UNC.
Yeah, I'm grateful for your support, so thank you.
Thank you. And thanks again for joining us on UNC Rex Health Talk. Our next show is May 31st. We're going to be live from the Rex Open, which is happening in Wakefield in North Raleigh. The annual Rex Open, which is a fantastic golfing event. Pro-Am Day will be on the 31st. We'll be there live at noon, so you can come by in person and ask your questions, or of course start submitting them now. We're going to be talking about sports injuries and different things you can do for all you weekend warriors out there. Have a great night, everybody.